So coronaviruses are a group of RNA viruses, not dissimilar to influenza, but they happen to be in a bunch of different animal species, and sometimes they jump over into humans. We actually have 4 coronaviruses that circulate every year, usually around the wintertime, that cause common cold symptoms. We've also happened to have had 2 severe coronavirus-type outbreaks with SARS and MERS in the past 2 decades. And now we have a new coronavirus called novel coronavirus 2019 that's currently spreading in China and a little bit outside in the rest of the world. So the coronavirus, although we don't know as much about this novel coronavirus, we know a lot about how other coronaviruses spread. And so what we suspect is that this coronavirus is spread by droplets. So if someone is coughing, for example, those droplets will spread throughout the air to about a distance of 3 feet before they fall. So if you're worried about becoming infected with the coronavirus, you're not going to get it from someone coughing about 6 feet away. But you could get it if someone is coughing right next to you, if they cough on their hands and then shake your hands, and if you don't wash your hands after touching something that might have been contaminated with a little bit of the coronavirus. So the simplest protections really are the easiest. We really want everyone to be washing their hands. It's flu season. Everyone should be doing this anyway, but be aware after you touch a doorknob, after you shake someone's hand, wash your hands, particularly before you touch your face, eat food, touch your eyes, anything like that. If you are someone who is sick and coughing, just be kind to others and cough into your sleeve or wear a mask. I'd first want to emphasize that while there is a very severe outbreak going on in China right now, we actually have very few cases here in the United States so far. So if you have been to China, or if you do know someone who had this novel coronavirus, and you're starting to feel sick, do please contact your doctor, call them first, call the ER if you think you're sick enough to go there and let them know you're coming, so that they can make sure you have a mask on when you come in to protect other people. However, if you haven't been to China and don't know anyone who's had this virus, it's much more likely that you have the flu. We are in a very severe flu season right now. So if you have all of these symptoms but haven't been in touch with anyone who's had this novel coronavirus, take care of yourself as if you had the flu. Practice good basic hand hygiene, and if you haven't been sick, get the flu shot.